Welcome to This Week in Washington for Friday, August the 17th, 2012. Late last week, the Federal Transit Administration released the promised request for proposals for services to create a new initiative around the topic of coordination. A new national center that supports the existing ongoing efforts that we've been making in this area is called for, and a commitment is also made to expand mobility management as part of the procurement. The other major piece that's in the proposal is a call for increased emphasis on one call, one click communication centers. As you know, we've been waiting for this procurement for a while, and we're very glad that it has finally emerged. We feel confident that our response to this procurement will in fact be the best one, especially since we have been so intensely involved in the development of a national curriculum for mobility management and have been guiding the one call, one click centers that have emerged as part of the veterans programs at the FTA. And as you know, we've taken a lead in working with communities on coordination for quite some time. In looking at the period ahead, we've begun working on our response by building into it partnerships and relationships that we think will be important to the next series of steps in this area. I'm pleased that APTA, as well as Easter Seals, as well as ACT and other organizations will be part of our submission. I look forward to also being able to put forward new ideas as part of this process. Earlier this week, I had a chance to meet by conference call with our ambassadors who are very concerned about the implication and possible changes in the work that they do. And what we emphasized to them was that there was significant work to be done in the veterans programs that they're working on now, and we know that there will be a role for them of some kind in this new process. On the subject of the veterans programs, I did bring up the fact that it is at least my opinion that much of the technology and relationships being developed there can serve as a platform for the kind of development that will have to take place once the Affordable Care Act begins its implementation process. As you know, transportation is very much a part of all of the benchmark plans that will be allowed to be created as part of the Affordable Care Act. Many of our organizations and many of our communities will have to deal with some of these situations in a very real way, like some of them are attempting to deal with the Veterans Administration. Institutions in the healthcare and insurance areas that have never dealt with transportation before, nor have they ever had a need to develop a relationship for transportation. The central focus of the Affordable Care Act, as far as we're concerned, is that the outcomes for success require achievements in patient care. Without transportation, since most of the patients are in an outpatient mode, it will be impossible for those managed care organizations to be paid if they don't have patient success. And to us, that means a significant increase in the attention paid to transportation. It's certainly my hope that the projects that we're working with the FTA and others on in the veterans area will serve as kind of a good example, especially in technology, for what we're going to be needing to meet these demands. As you know, we continue to support new and more flexible responses in the delivery of services as well. And I'm hopeful, again, that this will provide good information as we move forward toward that bigger implementation. There is certainly a great deal of controversy at the moment relative to implementation of affordable care, and I know that several of you live in states where governors have said that they're not going to participate. I still find it very hard to believe that having an opportunity to have the Medicaid program funded at 100% for 3 years is really going to prevent the kind of services that are needed and the ability to provide services that we can do, especially to groups now that don't get any form of subsidy for their transportation. So I think as that situation develops in the next year, there will be opportunities for our members to work at the state level to try to deal with this situation. Next week, I plan to be out of the office. You might remember that I did receive an invitation from the newly organized Community Transportation Association of Australia to attend their first meeting in the nation's capital, Canberra, beginning next week. Thanks to their gracious invitation and supporting my trip there, I'm going to spend a week with them looking at the issues on their national agenda as well as some local projects around the country. It's interesting to me that the number one issue on their agenda is how community transport will be able to function in an environment when insurance companies are making decisions for and about transportation. They're also very concerned about developing situations where the patients have control over the provider they select and actually have control over the money to pay for trips back and forth to healthcare. So I'm interested in hearing their views about these situations as well as sharing our own experiences. So I'm very much looking forward to going out there, as they used to say, to see what our colleagues are doing. And it's my understanding we'll be joined by some of our other colleagues from the United Kingdom with whom we've had a long relationship. So you will be able, thanks to the use of the internet, to reach me in Australia, even though I'm over there at a different time, anytime you need me or want to call something to my attention. When I get back, we'll be getting together for further discussions that we want to have at our upcoming board meeting in September, dealing with implementation issues for MAP 21 and also implementation issues as they affect the situation with medical transportation as it continues to develop further. In the meantime, I know that many of you are involved in the political processes that are unfolding across the nation as we begin to approach the next elections in November. There are 84 days between now and the next presidential and congressional elections. And I would hope that all of you, as individuals, on your own time, are making contact with the various campaigns to provide better education about the importance of community and public transportation. We suspect that after the elections, there will be a session of Congress that may attempt to deal with the significant budget problems that have been left on the table for some time. So I urge you to find an opportunity in the weeks ahead to talk to your current members and new members about doing the right thing for the importance programs that have such important meaning in your community. So that's all I can report for today. I shall be in touch from down under, and I hope you have a great weekend. So thanks for spending time listening to me today, and I'll look forward to hearing you and your comments soon. Thanks. Have a nice weekend.